Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the inguinal canal. The inguinal canal is an oblique passage in the lower part of the abdomen. It is just above the medial half of the inguinal ligament. So, this is an oblique passage in the lower part of the anterior abdominal wall, just above the medial half of the inguinal ligament. So we got the inguinal canal. This is an oblique passage. This passage was used by the developing testes during the intrauterine life to descend from the abdomen to the scrotum. Okay, so this is the inguinal ligament. We have inguinal ligament, and this is the anterior superior iliac spine. Anterior superior iliac spine. Here is the pubic tubercle. Pubic tubercle. Okay. The anterior superior iliac spine to the pubic tubercle is the inguinal ligament. On the medial half of the inguinal ligament, just above the, around half inch above, we will get the inguinal canal. So this is the inguinal canal. Inguinal canal. We got that. So inguinal canal extends from the deep inguinal ring to the superficial inguinal ring. The inguinal canal extends from the deep inguinal ring. This is the deep inguinal ring, and this is the superficial inguinal ring. Superficial inguinal ring. So we have a passage from the deep inguinal ring to the superficial inguinal ring. This is our inguinal canal. Okay, this is the deep inguinal ring. Deep inguinal ring. This is a gap in the fascia transversalis. This is a gap in the fascia transversalis. Fascia transversalis. Okay, so this is the fascia transversalis. Fascia transversalis. Okay, and there is a gap here. That is the location of the deep inguinal ring, and it is lateral to the inferior epigastric artery. Okay, this is the inferior epigastric artery. That is a branch of the external iliac artery. So you got the deep inguinal ring. This is the deep inguinal ring. This is the gap in the fascia transversalis. It transmits the vas deferens and genital branch of the genitofemoral nerve. Okay, and this is the superficial inguinal ring, this is the deep inguinal ring, this is superficial inguinal ring. It is a gap, we can call evagination, gap in the aponeurosis of external oblique. Okay, this is our external oblique. Here, external oblique. This is another part of external oblique. External oblique. Okay, there is a gap here. There is a superficial inguinal ring. Gap there in the fascia transversalis, the deep inguinal ring. From here to here, we have the inguinal canal. Okay, and this superficial inguinal ring is triangular in shape. It is attached to the pubic tubercle and pubic crest. It has two crusts, the lateral crust, medial crust, connected by the intercrural fiber between the two crusts. Okay, we got the superficial inguinal ring, deep inguinal ring. Now we go to the boundaries of the inguinal canal. Boundaries. Anterior boundary. Anteriorly, we have the skin, superficial fascia, Then we have the aponeurosis of external oblique, aponeurosis of external oblique, and laterally we have also contribution from the in the anterior wall. We have the laterally on the anterior wall we have contribution from the internal oblique muscle, internal oblique. So throughout the entire anterior wall it is bounded by the skin, superficial fascia, aponeurosis of external oblique. On the lateral aspect it is supported by the anterior wall, is also contributed by the internal oblique muscle. We got the, so this is internal oblique. Here this is internal oblique. This is forming little bit lateral part of the inguinal canal. Okay, this is the internal oblique. Okay, we got anterior boundary. Now we'll go to the posterior boundary. Posteriorly, it is bounded by the fascia transversalis, fascia transversalis. There is the posterior boundary. Okay, and supported by, on the medial aspect, by the conjoint tendon and conjoint tendon. What is conjoint tendon? Conjoint tendon is the joint tendon of the internal oblique and the transversus abdominis. This is the conjoint tendon. This is conjoint tendon. Okay, we got the conjoint tendon, posterior boundary. Now we go to the formation of floor. Floor is formed by the inguinal ligament and medially by the lacunar ligament, small part, lacunar ligament. Okay, this is the floor, this is the inguinal ligament. This is also inguinal ligament here, inguinal ligament. This is the external oblique muscle, external oblique. This is internal oblique. This is transversus abdominis. Abdominis. This is fascia transversalis. Fascia transversalis. Okay. And this is the inguinal ligament. We know that inguinal ligament is formed by the backward folding of the lower part of the aponeurosis of external oblique. We got the floor. We got anterior wall, posterior wall, floor. Now we'll go to the roof of the inguinal canal. Roof. Roof is formed by the arched fiber of the internal oblique and transversus abdominis. It will go like this way. Okay. So roof is formed by the arched fibers of the internal oblique and the transversus abdominis. Transversus abdominis. We got the boundaries: anterior boundary, posterior boundary, floor, roof. Okay. Then we go to the contents of the inguinal canal. Contents. Contents is the spermatic cord. This entire part is the spermatic cord. Spermatic cord. And we must say spermatic cord in male. Okay, so this is spermatic cord. It will go here is testis. Okay, here spermatic cord will go here as testis. Okay, so this is a scrotum. The testis here. Okay, it contains the spermatic cord in male, but round ligament of the uterus, round ligament of the uterus in female. Okay, we have also genital branch of genitofemoral nerve in both sexes, genital branch of genitofemoral nerve, genitofemoral nerve, and we also add the ilioinguinal nerve. Ilioinguinal nerve. Ilioinguinal nerve passes between the internal oblique and external oblique, and it enters the inguinal canal. It comes out through the superficial inguinal ring, and it ends up near the superficial inguinal ring. It does not go through the deep inguinal ring. It doesn't go through that. It comes out posteriorly between the external oblique and internal oblique, and it come out of the superficial inguinal ring, and it end up here. Okay, so we got the contents of the inguinal canal. Okay, now learn some applied anatomy or the clinical anatomy. Clinical anatomy. Okay. The inguinal canal is very important. It is important to identify the inguinal hernia, inguinal hernia. That may be indirect, that may be direct. It may be on one side, it may be on both sides. Indirect inguinal hernia goes through the deep inguinal ring. The direct inguinal hernia comes out through the superficial inguinal ring. We may have another term that is called undescended testis or cryptorchidism. Okay, cryptorchidism, crypt or chidism, that is undescended testis. So testis may not go to the scrotum, testis may be stuck here. Okay, so that may cause a lot of problem, may lead to male infertility or may lead to eventually to cancer. So that's all about the anatomy of the inguinal canal. If you like my video, please support my channel. Please subscribe me, share the information with your friends. If you have any question, please feel free to ask me. Have a nice day. Bye now.